Hello, I'm George Latimer, Westchester County Executive, and welcome to our Facebook COVID Conversations. The calendar has just turned to month of September 1st, and with it, all of our thoughts start to focus on the fall season, which generally means back to school. But back to school this year is going to look very different from any year that we've ever experienced to this point. There are going to be a host of issues to deal with, and that's what we're going to talk about on this edition of Facebook Conversations. We're joined by Dr. Joseph Ricca, who is the superintendent of the White Plains City School District and a past guest here with us. And we have two of our professionals who are with the Department of Community Mental Health. We have Deputy Commissioner Joe Glazer, and we have our program coordinator, Tori, who's with us today. So thank you all very much for being with us. There are certainly physical aspects to being ready for back to school. Things that we know that we've been practicing in the community at large, that now that school will be coming back, even in a hybrid fashion, will have to be enforced in order to have physical health. And with that thought in mind, we put together a couple of public service announcements to highlight hand washing, mask wearing, and targeted for the kids, because that's really what this challenge is going to be about, getting the buy-in from students as young as kindergartners up to 12th graders. Take a look at our PSAs on this topic. A lot has changed since the last time we were at school, and we all need to take extra steps to stay safe from COVID-19. When you go back to school, you'll have to wear a mask. It can stop germs from spreading to your classmates when you talk, sneeze, or cough. But your mask will only work if you wear it correctly. When you wear your mask, put the loops over your ears and keep your mouth and nose covered. Once your mask is on your face, you don't want to play with it. If you play with your mask, you could be letting germs into your body, and they can make you very sick.
What if I need a break from my mask?
Our masks can get hot and be annoying if we have to wear them all day. It's okay if you need a break. Ask your teacher if there's a spot where you can sit and take your mask off for a few minutes. Masks can also be fun. They come in all different colors. Coaster's favorite color is blue. But most importantly, your mask will keep you and your friends safe at school. Germs are everywhere. They live on our hands and get stuck to things that we touch, like doorknobs, or our pencils, or our computer mouse. Most won't hurt you, but germs like COVID-19 can make you very sick. Germs can enter our bodies if we touch our eyes, nose, or mouth. That's why it's important to wash our hands a lot. Soap will kill the germs on your hands. Make sure you scrub in between your fingers and under your claws.
How long should I wash my hands?
You should wash your hands for at least 20 seconds. Time yourself by singing the Happy Birthday song or any of your favorite songs. Happy birthday, happy birthday, happy birthday to you.
What if I'm not near a sink?
If you can't wash your hands with soap and water, use hand sanitizer. Your school will have hand sanitizer, and your parents can get you some to keep in your backpack. When you go back to school, you'll be busier than a bee. But remember, there will always be time to wash your hands. Going back to school is going to be very exciting. We're going to see friends that we haven't seen for a very long time. We're also going to have to follow some new rules so we can stay safe from COVID-19, a germ that can make us and our classmates very sick. Everyone will have to check their temperature before they come to school. When we get to school, we will have to social distance, just in case someone is sick and we don't know.
What does social distancing mean?
Social distancing means that we have to keep at least 6 feet apart from each other. Our teachers have been working to get us ready for our time in class, and we can social distance when we go back to school. Depending on where you go to school, your class may be smaller, and you will probably sit at a desk, not a table. When you see your friends for the first time, you might want to give them a hug or a high five, but try not to. Germs can spread easier when we are closer together. If you can't social distance, make sure you wear your mask and wash your hands to stop germs from entering your body. Well, we want to thank Coaster, our Playland Dragon, and our Bee from the Beeline bus system for helping us make those points to kids. And the physical safety of our students, of our teachers, of our administrators, of our various other administrative workers in the building, custodians, people who work in the lunchroom. All of their health is important, and it's advanced physically by making sure we wear masks, sanitize our hands, and use social distancing. But there's another dynamic that we have to look at for the fall season, and that is that since this is very, very different, it's an environment in which we're going to try to have kids at whatever their age is and their capacities are to learn topics that could be as simple as addition all the way up to algebra, calculus, and so forth. And the mental health stress that this effort has created around dealing with COVID, day after day of being home for months and now being back in a school setting, creates some very interesting challenges. So we're going to talk with our panel. We've got some people who are on the firing lines of these things, both with mental health responsibilities for Westchester County and running one of the largest school districts in the county. So, Dr. Ricca, we'll start with you. What kind of mental health and wellness issues do you expect to see as we return to school? And that's across that whole range, Joe, of the people that are under your care as superintendent of a district.
Well, thanks so much for having me back, and thanks for those great videos. I think they're going to be really fantastic and well received by the kids. We're expecting that we're going to see a number of mental health issues related to COVID-19, related to quarantine, related to the ongoing stress that children and families have been experiencing. Certainly, we're ready for it with our children, whether it be feeling of detachment, whether it be feelings of being alone, an uncertain looming, just blanket fear, getting reacclimated to coming into school facilities. All those things are going to be a process as we move forward. And we've been gearing up over the course of the summer and working really closely, not just with our teachers and support personnel, but also with our county partners and our local partners to make sure that those folks who are in the caring professions, the helping professions, are available to our children and our adults when we come back in.
And that's the interesting thing as well, because these mental health issues aren't just limited to the students, and students very young, students who are approaching the age of 20. They apply to the teaching profession, they apply to the administrators and so forth. What do you see as some of the mental health issues that we have to deal with?
Well,
Tori?
I think that this has, to say the least, been a very stressful time for our kiddos and for their parents and their teachers. And so I think, what we want to remember is that we may not know everything that a family has been dealing with this last 6 months. And so because of that, we want to come prepared with patience, with flexibility, with empathy, and really expecting that families will have experienced loss. Families may come in highly anxious. We may see kids, teachers, and parents who are more moody than they've been in the past, more sensitive to stress than they have been previously. And so those are things that we want to keep our eye out for and be flexible and patient with as we're transitioning back.
Joe, I gather that one of the key in dealing with these things is communications, is the way that you try to both identify and then address in the way we interact with people, these stresses that exist. Any thoughts that you have that you think would be practical about how we go about making sure that communication structure works well?
Well, I think first and foremost, what we've done from the county's perspective, and as you know, thanks to the work that we've done since July, the county has been very closely connected. Joe Ricca and the school superintendents have been wonderful in not only helping to develop the message, but also conveying the message. And as we work together on a regular basis, we really think not just about the specifics of what we need to do, but how to communicate that to the community. Your communications department has been wonderful in getting the message out. The school superintendents have been wonderful in getting the message out. And we continue to build every day on what we've been able to accomplish so far. And that's part of the communication. But I think what Tori just mentioned, and that is the interpersonal aspect of it, is extremely important. We need to understand that for families, that the expectations need to be different than they were when we started school last year. That where our children are, who's going to be in their classroom, who may or may not be present, and what happened even in their friends' families could have a huge impact. And we need to understand that we need to allow children to communicate with us. We need to listen to learn and listen to help. And it's no longer about just redirecting behavior. It's far more now about understanding behavior and working with kids.
And how important is it to have a routine, something that sort of anchors the way we operate day to day? Obviously, there's a routine inside the school structure, but also outside the school structure. Care to comment?
I'm going to hand that one off to Tori.
Okay, Tori, and then Joe.
Yeah, absolutely. Routine is extremely important, and school is really great at helping students have a schedule for their day. But routine is a little different. Routine is a little less rigid, it's a little bit more flexible, because it's really just about helping children, parents, teachers know what to expect out of their day. And so that may not be that from 9 to 9:45 they're doing a specific task, but more so to know that every morning, whether I'm going to school remotely or in person, I'm getting up, I'm brushing my teeth, I'm getting dressed. Because when the time comes for them to go back to school, we want them to be in those routines. And it's important that we let kids be a part of making those routines with us so that they have input and their voice is heard. Because there are going to be parts of that routine that are really important to helping them feel good throughout the day, building those kinds of activities in. And then there are going to be things that the teachers and parents need from their kids throughout the day. So it's a really important part of transitions.
Joe, if a student is struggling, you're in the educational setting now, when a student is struggling with their mental health issues or struggling with the return to school, what do we do? What can we do?
Well, first of all, for parents and guardians, if you notice that your child is struggling, or you've noticed that your child's been struggling since March or even just more recently, reach out to your teachers, reach out to your building level principal, reach out to your superintendent. Make sure you make that connection. There are folks available in all of the districts that are ready and willing to intervene and help and assist. We have to realize that in order, you talked about just before getting back to algebra, getting back to calculus and trigonometry, absolutely. Before we get back to that, though, we have to make sure that the human side, that the basic human side is being taken care of and looked after. And so if you're noticing those types of things, you're noticing a withdrawal, a change in attitude, a change in demeanor, a heightened level of anxiety, making that connection, reaching out early can make all the difference in the world.
And what do we do from the standpoint of the county's community mental health department? What can we do to support what the schools are doing?
Well, first and foremost, thank you for pointing out the importance of families communicating with their school, because it's really important that we keep everyone on the same page. Teaming up with our partners is the best way to really help kids to feel supported and help families to feel supported. So we work very closely with our school partners across districts in the Children's Mental Health Services Division. We have very close relationships with our districts and with both Southern Westchester and Putnam Northern Westchester BOCES partners. And so we're working closely with them to identify what the needs are and to help connect kids to services if schools need more help with that. So it may be that in-school supports are a good enough plan for that family at that time. But if a young person needs more supports outside of school, the school counselor or DCMH directly can connect them to those supports.
Joe, anything you want to add to that either?
If you don't mind, I just
Please.
want to add that sometimes there's a stigma associated with struggling with depression or struggling with a feeling of aloofness. And for parents and guardians, for students, any child watching this, anybody watching this should understand that there is nothing at all to be ashamed of. And that if you are struggling, if you are feeling bad, if you're feeling like you're down, making that connection can help. It's not weakness. It's actually strength. Taking that step forward and making that connection and then reaching out for help is a sign of strength.
That's a very good insight. Joe, I know that we have a cooperative program with WJCS, the Youth Adult Mental Health First Aid Training Program. Can you describe a little bit about what that program does and how it may fit into what we're dealing with there?
Yeah, Youth Mental Health First Aid is really a program, it's an intensive program of helping people to understand some of the basic tenets, not just of mental health and for children, various levels of behavioral issues, but to identify them, to recognize them, to deal with them, and to help make the connections so that folks in the community can connect themselves and their children with the appropriate services that they need. It is a well-researched best practice that is used all over the country, and we've had it here in the county, but because of the additional support coming in from the county, we're able to expand that effort and to get it out to more people, understanding that as the issues of mental health grow during a situation like a pandemic, the need for us to help people have better responses comes to it as well. So I think that pretty much covers the youth mental health first aid. But one other piece that I want to touch on before we move on from this is that we've talked an awful lot about what we're doing in schools. But as chair of the county's school reopening work group, we have included the folks working with children with special needs every single step of the way. We've included their schools in the process, we're including their teachers in the process, because as we move forward, we have to remember that there are children out there whose needs we're already addressing, who could be even more affected by what's happening, and their needs could actually be increased. So we've actually incorporated that into all of the work that we're doing too.
And tell us a little bit about the cooperation that we have with Southern BOCES and Northern Westchester BOCES.
Yeah, absolutely. Right now, the need for support, training, professional development opportunities is higher than ever. Schools have been incredibly committed to the social emotional learning work, and in addition to being able to provide more youth mental health first aid training in partnership with WJCS over this next school year, there may be other training needs that we identify, and that with BOCES we can work to either develop or link to the experts in the field that can help teachers, school staff get all the tools that they need to be able to support our young people and their social emotional health at school.
Very good. Joe, as we start to wrap up our conversations, all very interesting and helpful, and now the heavy lifting is ahead of us. Just review with us the operations, the supports for opening schools, the things that you need for this thing to work.
Did we say we were wrapping up? In all seriousness, it's been a challenge, but it's been a challenge that I think we've all been laboring out of love. Every single one of us wants our children back in our schools, safely supported, making sure that PPE, all personal protective equipment, is in place. Coordinating with the county, coordinating with the state, with our local municipalities, making sure that the training is in place, all of the signage that's required, the reduction in density, putting schedules together to allow for as many children back into our buildings as possible, and on top of it, all of that training, professional development, and support services that go along with it. That's a snapshot into what it's taken so far, but really what it's going to take to make this work and to continue to allow us to be in our facilities and to service as many children as possible is those fundamental things that you talked about in your videos. Washing our hands, wearing our masks, staying home when we're sick, physically distancing, social distancing. All of those things, I mean, we know it works. It's worked in the state of New York. It's worked in Westchester County. It will work in our communities if we attend to those things. And as we move forward in the school districts, that's really what we're working on, making sure we're reinforcing that, making sure we're being supportive and allowing our children to understand and know that we want them back. And in order to accomplish that, we have to continue to work together.
And Joe Glazer, tell us what the county is doing to try to help support the school districts in these efforts.
Well, we have tried to be a good partner and supportive in the work that they're trying to accomplish. We are regularly answering questions on the healthcare side through the Department of Health, from what to do if there's a positive to facilities questions about can we use exhaust fans? Can we use window air conditioners? It runs the entire gamut, the questions that are coming up. And I can tell you that the County Department of Health staff is working diligently to address that. But there are other things that we're doing. We're in the process of putting together a plan to make sure that the school staff who are mandated to wear N95 masks are fit tested and properly equipped, and everything that we can do. But we're also, on the more micro side, We are working, as Tori has said before, we're working in the schools with the teachers, with the staff, and making ourselves available so that as these issues come up, not just as we're easing back into school, but while we're in school, that we can continue to help address the questions that arise and the problems that, admittedly, we all know that there's going to be problems. We all know there's going to be bumps in the road, and we're here to do whatever we can to make sure that this process continues forward.
And Tori, we'll let you get the last word.
Well, as I'm listening to the two Joes here, it really makes me think how important it is to point out that we are all in this together, and that this is really hard. I'm a parent of a kindergartner and a 12th grader, and a professional here, and I think on every layer this has been an incredibly challenging last 6 months for everyone. And so I think that the importance of leading off with empathy, with remembering that everyone's trying to do their best, and that it's really important that we keep talking to each other about how we're feeling, about what we need, and that we keep that communication open across the board.
We've been talking with Tori Shaw, who is the program coordinator for Westchester County's Department of Community Mental Health, with Joe Glazer, who's our Deputy Commissioner of the Mental Health Department, and with Dr. Joseph Ricca, who's the Superintendent of the White Plains School District. And we've spent some time discussing some of the mental health challenges as well as the physical challenges of opening our schools. And of our 44 school districts across Westchester County, some will be opening in a hybrid teaching setting coming up after Labor Day. Some will have remote learning at the outset of the term, and perhaps planning to go hybrid by October. Each community has their own different strategy. So we encourage you, if you're watching this, to call your local school superintendent, local school board, and get the information of what's happening in your backyard so that you're prepared for it, for your children and for their best health and their best safety. Thanks for being with us all. We appreciate it. Thank you for your hard work and professionalism. And thank you for watching. I'm George Latimer, Westchester County Executive. We'll see you again soon. Stay safe.